Hey guys, you join me in London where I'm about to start a shift in A&E. Over the last few days we've seen a sharp rise in the number of cases across the UK, in fact, and a rise in the number of deaths as well, sadly. We're seeing departments up and down the country getting busier and busier as the pressure from coronavirus builds up. We're seeing more patients requiring ventilators, requiring specialist input and support from us in the accident and emergency department. We're very grateful to those who are maintaining social distancing, who are staying at home, because at the end of the day, that is what's going to take pressure off us on the front line and allow us to keep as many people safe and the death rate as low as possible. Working very hard. The morale on the front line is still good. We want to make sure we look after our patients as best as we possibly can. We've currently split the department into sections, almost in a kind of military style, so that we've got patients who are not infected with coronavirus in certain parts of the department, separated away from those who may be infected from coronavirus. It's so important, as I say, that everyone is staying at home, washing their hands, and those that are in the vulnerable categories are doing their very best to be isolated and reduce their social contacts as much as possible. I'll obviously continue to give you guys as many updates as I can. I just wanted to give you an insight into what's going on at the moment. My spirits are high. I feel that we've got enough protective equipment on the front line to do what we need to do and to be able to perform our job as safely as possible. Of course, none of us want to catch the coronavirus. All of us want to remain safe, and that is absolutely paramount. So guys, I've just taken a moment to have a chat with Dr. Khan, one of my very good friends and one of the senior registrars here. We've just taken a moment from the busyness, the madness really, to have a little chat about what's going on in the hospital. Farah, we've seen it getting quite busy now. Do you think it's been a difference in the last few weeks now?
It's been a difference in terms of patients, so we are trying to separate the patients we suspect are having COVID virus, and then so in a way the workload has been divided, and I must say in our department they established a very good system, which is turning out to be very helpful.
Yeah, because they've now, I spoke about this a little bit before, they've split the department into kind of patients we think might have coronavirus and ones that aren't, because we don't want to mix the patients, right?
Absolutely.
Do you think the number of cases are increasing each day?
Yes.
More cases?
I have a feeling, yeah. We're seeing more and more. Maybe the patients are becoming more and more aware, but they're presenting. We're seeing quite a number of increase.
Yeah, and some of them are requiring. Some of them are doing very well with a little bit of help, and we're sending home. You know, it's worth saying that we're sending a lot of patients home. Actually, yes. Thankfully, most people are self-isolating and following our advice regards to having minor symptoms. And some people come here, a little bit of test and reassurance, and they go home.
Absolutely.
But of course, some of those who are unwell require help. Is it, from your experience, is it generally those with in the vulnerable groups with risk factors that are more unwell?
Yes, absolutely. And people who are well, I would request try and stay at home and try self-monitor. Yes, if you're deteriorating, we're more than happy to see you anytime. Yeah. But only if you can manage at home. Simple paracetamol, increase fluid, wash your hands, keep social distance. That's about it.
So amazing advice from Dr. Khan. So thank you so much for your advice. So yeah, if your symptoms are getting worse, call 111. But otherwise, try your best to manage things at home. And of course, we're always here to help you if you need our help. Hey guys, welcome back to my YouTube channel. You've just seen a clip from my shift I've just done in A&E, giving you a bit of an update on the situation. In my last episode on my YouTube channel, I talked to you guys about kind of what's going on, what it's like to see patients in A&E with coronavirus, and a little bit of advice. In this episode, I want to talk about testing kits, when we're all going to be able to have our tests done, and what they really mean and why they matter. Latest figures show there's over 17,000 confirmed cases of coronavirus in the UK, with over 1,000 deaths now. So let's talk a little bit about coronavirus testing. It's something that we all want to talk about. Why does it matter? What is the situation? When are we going to have widespread tests? Because there's a huge amount of pressure, from frontline staff, because we're in that situation, we're seeing patients with coronavirus, and we want to know, when can we get tested? When can we find out if we have it right now? And when can we find out if we've had it and if we're immune? They're two really important questions. Of course, in the community, you guys want to get tested and know yourselves, because if you've had a cough and a fever, you want to know, have I got it? And you also want to know, is there a chance that I've had it and I didn't even realise it and I'm immune? So there's two types of tests really that we broadly split this into. So it's antigen testing versus antibody testing. Antigen testing is essentially
is there the presence of that virus in your body right now? Is it there right now? And we're using swabs to do that. We're taking swabs from the nose or the throat, sending them away to the lab. They test that and look for a viral PCR. It's a way of looking at whether there's the presence of the coronavirus there in that individual at that moment. Antibody testing is where we usually would do a finger prick test or similar, or take a sample of blood, and we look for antibodies against that virus, either IgG or IgM, the two types of antibodies we commonly look for when we're doing these tests. So if you split it, essentially it's saying, do you have it right now, yes or no? Have you had it at some point, yes or no? And are you immune to that at present? So what are the barriers? Why have we not got loads and loads of testing? There's reports other parts of the world, South Korea, have widespread testing already amongst their workforce and the community. So why have we not got it here in the UK? Now, part of the reason is a lot of these countries are ahead of us. They have their cases much sooner. And in some cases, particularly at South Korea, they were very quick to act. They were quick to act to get and buy up all the pieces and components they needed to do their testing. Because essentially, any testing kit has certain bits. You need your swabs, you need your sticks, you need your tubes, you need your reagents, you need the stuff that actually tests the sample itself, and you need to acquire all those pieces. Now what's happened is around the world, everyone is trying to buy the components and parts, if you like, to these testing kits. Because we're a little bit later along to the game, we are now in a very different marketplace trying to get hold of these pieces of equipment. We are trying, first of all, to massively ramp up the antigen testing, the do you have it right now, yes or no, because that is the first thing we need to do. Yes, of course, there's research and work being done and working on the antibody testing. It's believed around 3.5 million test kits will eventually be available on the antibody side. They're working hard to do that, but what we need to know, first of all, is the yes or no, does this person have it? And so at the moment, they've just announced that in the UK, NHS frontline workers, those in critical care, intensive care, A&E, paramedics, they will soon be tested in specialist checkpoints, if you like. So what they've announced essentially is that they are opening 3 labs. The first one's opening pretty much immediately and will allow us to increase the capacity of testing we're doing for antigen. So at the moment they're doing around 8,000, in England 8,000 tests per day. They're hoping to increase that capacity rapidly to around 25,000 per day by mid-April. And so essentially we're beginning to see the rollout of that now into the workforce. So hopefully in hotspots, like in London and other parts of the UK that have got a lot of cases of coronavirus, they can have these checkpoints where you drive into, if you're an NHS staff, drive into, a nurse will take your swab, you'll drive off, and then you'll be informed within a few days as to whether you have the coronavirus or not. Clearly, if you find out you don't have it, you can go back to work. So that's really, really important. We're all itching for this to happen. We all want to see the testing become widespread. That is the picture at the moment with the antigen testing. In terms of the antibody testing, this is going to take a bit more time because we need to know that it's reliable, that we're able to accurately tell people if they have been in contact or not with the virus and whether they are immune. So that's going to take a period of time. It's expected that we're going to try and have around 3.5 million of these test kits. It'll obviously be very important and very useful because, in the frontline sense, knowing that you have had it and you're hopefully immune to the coronavirus is very, very important, as you can imagine, for NHS workers and staff. So obviously for a member of the community, if you've had symptoms a few weeks ago and you want to know, did I actually have coronavirus then or not, or was it something else? It's very, very important. So if you have the test and you go, right, well, actually, yes, I did have that. That's what I had a few weeks ago. You know that you've got a level of immunity. However, if you have the test and actually it's negative and you haven't come into contact with the coronavirus, clearly, you're very aware of how important then it is not to come into contact. Next question I guess people are asking is, well, that's all very well, but how do I get these tests? A lot of people want to know, can they buy this test? Will it be available at your local Boots, your Superdrug or pharmacy store? And the answer to that at the moment is no, you won't be able to buy these privately, these tests. they will be allocated as kind of public health, the NHS kind of sees fit, and where they think those tests need to be at that time. So over a period of time, it will be rolled out from frontline staff to those who are symptomatic in the community, and then those who are asymptomatic as well. The idea being, essentially, we will have this like gradual rollout, stage by stage, to the people who most need that test. Do I think that it will be available to buy in the future and potentially even abroad? Probably. Once the period of time has rolled on and these tests have become available to the right people, there is potential, of course, that you'll be able to buy them privately. But I don't think that will be that soon. In the UK, at least, it will very much be controlled so that the tests are going to the right place at the right time. Thank you everyone for watching this video. I hope it's been useful. In summary, we're going to be seeing these antigen testing rolled out, ramped up in the UK. We're going to be getting frontline staff tested in these kind of hotspot locations, almost these drive-through locations in the UK. This will then be rolled out to other members of the population. And the antibody testing, there's a lot of work being done on that, but it does take time because of the kind of steps they need to go through to make sure the test is correct. That if it tells you you've had it before, that you've actually had it before. Again, I hope it's useful. Please do comment, let me know any of your thoughts. I will be doing a Q&A video, as I've said, but I really wanted to answer this question around testing because I know a lot of people have been asking that. There's a few videos available where I've been talking on the front line, giving you guys an insight, so take a look at those. Stay safe, remember to wash your hands, and please do follow the social distancing rules. Thank you everyone, take care, and goodbye.